Welcome. We're going to discuss entheogens and psychedelic medicine for mental health. What are the applications of psychedelic medicine for mental health? The origins of psychedelic medicine go back millennia, and we'll discuss in a moment the cultural indigenous uses of these natural plant substances, and more recently, since the 1940s, some of the substances synthesized in the laboratory. In modern psychotherapeutic practice, psychedelic medicine began in the 1950s and really came to an abrupt halt in many respects during the 70s in the United States. Much research in medicine was carried out in other parts of the world, and it's only now, with changes in regulatory statutes and a lot of education and clinical research, that we're seeing a resurgence in understanding the benefits and applications of psychedelic medicine. And that's what I'd like to explore with you today. Some of the principles of psychedelic medicine application suggest that psychedelic psychotherapy catalyzes the psychotherapeutic process. It amplifies the significance and the meaning of thoughts and feelings. It encourages an exploration of existential meaning in a deeper way as a result of psychedelic medicines. It enhances or facilitates profound spiritual experiences. It may decrease ego identification that get in the way of spiritual experiences, particularly among people who are facing death and experience death anxiety. Psychedelic medicine is used for PTSD, where there's a deep existential loss of hope, loss of capacity for attachment and trust, for example. These medicines are used to reduce fear and also to encourage the sense of something greater and to reduce recidivism where there is a loss of hope, whether it's recidivism related to criminal behavior or addictive behaviors. Psychedelic medicine is used for the addictions, for alcoholism and drug addiction. It's been used and studied for obsessive compulsive disorder. It's widely used for the treatment of PTSD and its sequelae. It's used for depression, pain, anxiety, and as I mentioned, death anxiety, anxiety due to cancer, and also migraines. It's also being studied for the reduction of social anxiety in autism spectrum disorder. A recent research article in the Journal of Psychopharmacology examined a national survey of over 190,000 adults in the United States. It found a lifetime use of certain psychedelic drugs was associated with a 19% reduced likelihood of psychological distress within the past month, a 14% reduced likelihood of suicidal thinking within the past year, a 29% reduced likelihood of suicide planning within the last year, and a 36% reduced likelihood of attempting suicide in the past year. Legality of practice. Clearly, this would be first and foremost on our minds. Most research is where psychedelic medicine is being used in clinical practice. It's being applied in clinical research settings worldwide. In the United States, regulatory decrees have allowed its use for research increasingly over the last few years. It's being used by psychiatrists and physicians in office settings where the particular substances are legal or approved for research purposes. There is clinical practice going on outside the United States, in the Caribbean and in Mexico, in European countries and South America, both in traditional and in conventional treatment settings. And then there's an underground practice that's been going on since many of these medications or drugs were made illicit back in the 60s and 70s. that has continued all throughout the world. As you're considering the value and the benefits and the potential application of these different medications or drugs for your client, consider where you're going to reach out and make connections with clinical research projects, with research databases, or with practitioners. And at the end, I provide you some resources about where to study about this more and where to read more and who's doing what, both legally and, well, I won't share illegally, but where this work is going on throughout the world. I want to make a connection between psychedelic medicine with traditional spiritual practices, because traditionally many spiritual practices are rooted in the use of what we'd call psychedelic medicine or entheogens. For example, the Native American church peyote ceremony practice in the United States Southwest. This is a legal practice ordained by the Native American church. And this is a practice that's very much devoted to helping people eliminate addictions and to maintain sobriety, and also to practice spiritually as well. The Wixárika of central Mexico, also known as Huichol, are also practitioners of the peyote ceremony. The ayahuasca ceremonies practiced by the Yorarina shaman in the interior Amazon and regions of Peru. There are mushroom cults using the Amanita muscaria of Siberia that have long been part of indigenous traditional practices. The Mazatec of northwestern Oaxaca in Mexico refer to their trance-inducing mushroom as Nitzitho. So all throughout the world we find nature's gifts have given us plant substances, generally plant or fungi, to alter states of consciousness. The common themes that we see are spiritual, sacred, and therapeutic in all of these practices. Let's look a little bit at definitions and a little bit of history. You notice I use the term entheogens. Also, psychedelic medicine is used these days. We've used the word hallucinogens, psychedelics, and psychomimetics. Psychomimetic meaning mimicking psychosis. That was a term used back in the 50s. One term of reference comes from the Greek word entheos, referring to the God within. Gen meaning the action or becoming. And so some of the researchers developed this term entheogen to refer to substances that lead to awareness of the God or goddess within. It's the generating experience of God. And these are also called plant sacraments or shamanic inebriants that evoke religious ecstasy, that include visions. Let's continue with the definition of psychedelic. Psyche meaning mind, delos meaning manifesting. And this was coined by Humphrey Osmond in 1957. And I refer you to the reference, a review of the clinical effects of psychomimetic agents. Psychedelic is a term that developed in the context of LSD. It refers to extraordinary conceptual mind manifesting impact upon the human experience and understanding. And the term currently used in our field is psychedelic assisted psychotherapy. To continue with our definitions, psychoactive, producing inebriation or alterations in the state of consciousness, whether stimulation, sedation, euphoria, etc. A hallucinogen are all those substances that produce distinct alterations in perception, sensations of space and time, and emotional states. Winkelmann, a medical anthropologist who's done wonderful work in neo-shamanism and altered states of consciousness, uses the term psycho-integrator, the stimulation of mind, emotions, soul, and spirit to integrative development. It stimulates mental and emotional catalyzing processes. encourages a holistic developmental integration of the mind, spirit, and soul. Now, all of these substances are rooted in early spiritual practices and the development of religious practices. In religion and spirituality, these substances have been found to be used in the archaic world in divination and for shamanic healing. There's evidence for the use of entheogens in the Holy Communion, even the Eucharist. There's certainly the initiation into the Eleusinian mysteries, all organized around becoming divine within. And I want to share with you some images and just a little bit of a journey through some of what we know from the historical record. Here you see an image of the Garden of Eden, and what do we see but a mushroom with a snake wrapped around it and an image of Eve. The question posed by historians, was the apple that Eve ate actually a psychoactive mushroom called amanita, hence giving rise to the development of religion? And I've given you a reference here of the historian who posits this question and provides evidence for this. We recall from our study of Greek myths, Demeter here we see with barley, opium, and snakes, her consorts. And we recall the abduction of Persephone, her daughter. Now, on the one level, the story of Persephone and the abduction is about her abduction by Uncle Hades down into the underworld and the disappearance of the spring into the fallow times, and then the reemergence of Persephone, hence spring, and the harvest, well, the harvest of the fall, and then returning for the spring as well. Now, Demeter went to Zeus, her brother, and demanded the return of Persephone. We could understand the abduction of Persephone also as a story of rape and abduction by the uncle, and the demand by the mother for the return of Persephone so that mother and daughter could be reunited. Now, yet another interpretation of the abduction of Persephone is located in the fact that she was picking the hallucinogen, the narcissist, which took her into the underworld, and a journey whereby she returned transcendent after battling the demons of the underworld. So there are many, many levels to the story of Persephone and Demeter. Here we see the Mayan deities and the mushrooms. We have many psychoactive mushrooms in Mexico and Central America. Now, when the Spanish arrived, they suppressed the sacramental use of the mushroom by the Nahua. This was called the flesh of the gods. So central was mushroom ritual use to Nahua or Aztec ritual process. There were also other ritual foods that were not psychoactive, but were part of those ceremonies that worshipped, and included in those foods were amaranth as well. Now, these both mushrooms and foods were safeguarded by indigenous peoples until such a time that they could be used again and reemerged. And indeed, the discovery of the mushroom occurred by Gordon Wasson. The discovery, shall I say, by anthropologists occurred in the 50s by Gordon Wasson. And you can read more about this story, for it's got a lot of breadth and depth to it in the introduction of the mushroom into modern psychotherapeutic use. So psychoactive plants and religion, you see here an image of witches who were flying. Now, witches did not literally fly on brooms. They flew because they rubbed psychedelic herb creams onto their body, and they left their bodies and flew into trance states. However, also the Inquisition confiscated these herbs, and we know about the Inquisition in its variety of forms in terms of suppression of different kinds of medicine and practices. You see here an image in Psychedelic Medicine of medicinal mushrooms. There's a wonderful quote by the director of the National Institutes of Mental Health. "I'm personally biased in favor of these types of studies," talking about psychedelic medicine. "If it proves useful to people who are really suffering, we should look into it." Let's look at one of the most important and well-known psychedelics or entheogens called LSD, lysergic acid. It's a hallucinogen chemical derived from the ergot fungus that grows on rye. Albert Hofmann accidentally synthesized LSD in 1938. LSD was used as early as World War II to treat Dutch survivors of concentration camps. And Bill Wilson, the founder of Alcoholics Anonymous, not only took LSD under the guidance of a psychiatrist and had intense spiritual experiences, leading him to conclude that LSD could help others with alcoholism. I'd like to share with you a video that is taken with a cancer patient using psilocybin as part of a research project at a New York hospital.
The urologist kept describing my cancer as a rare bird. It was called small cell carcinoma, and I'm going, oh no, this is like really bad. I'm sort of chuckling today, but I wasn't chuckling before. And then friend after friend would just speak up and tell me how much they supported me. So in turn, when I took the psilocybin, I don't think I've ever experienced, ever, the gratitude that I felt. And gratitude for what? It was just gratitude. I don't like to talk about it because it's really beyond words.
Psilocybin is the psychoactive component in 180 species of psychedelic mushrooms. It's made a comeback within science as a research tool to treat various disorders such as distress with terminal cancer, addiction, depression, or some of the clinical targets being explored. Close to 40% of Americans at some point in their life will get cancer, and of those that get cancer, about half will have some diagnosable psychiatric disorder. If untreated, is associated with a bunch of very bad outcomes, including depression, hopelessness, suicidality, even decreased survival rates from the cancer.
But the spiritual, psychological, emotional, existential distress, that despair, is harder to reach.
Doctors are not trained how to help patients deal with a spiritual crisis or emergency or any of that sort of thing. Psilocybin, it appears, targets this existential or spiritual distress. I was really surprised that it worked, because in our cancer trial we found one dose of psilocybin had immediate reductions in anxiety and depression, and it lasted for weeks to months, which is a unique finding in psychiatry.
Some have used these drugs to journey into the uncharted tunnels of the mind in search of medical and scientific truth. Others look behind the curtain just for kicks.
We can look back at the 50s and 60s and 70s, and the research came to a grinding halt when there were these social, cultural, legal changes of the 60s. So we're very mindful of the past.
And people can get in a lot of trouble. So I worry people would look at this research and say, okay, this is safe to use. And really, it's not. The only way this should be used is a highly regulated, controlled, structured environment. And it's not just a drug experience, it's a medication-assisted psychotherapy experience.
So preparation, the experience, and the integration of what happened contribute to it being powerful. It isn't just in the molecule itself.
I had the medicine, the psilocybin, on December 9th of 2013. Yeah.
We have 3 preparatory sessions and form a really safe kind of container.
The psilocybin is stored in a little black bottle within a 900-pound safe, and it's weighed every day, and 2 people record it. Everyone holds hands, the patient states their intention. And in a little bit of a nod to ritual, we take this chalice here, and we take it out of the bottle here. They will put it into their mouth and swallow it. When the person feels the effects of the drug, we would ask them to put their eye shades on. And Tara, you want to put the headphones on? And then this is the default position for hours. Two therapists sitting here. We check their blood pressure every half hour, but we essentially sit here in a kind of meditative stance for a long time.
And I lay there, and nothing happened. And at one point I said, why is this taking so long? And Jeff came over and he knelt right by me and he said, Eddie, it's taking exactly as long as it needs to, you know. And then it seemed like right after that, I just took off.
It all takes place in one room. The participant is not allowed to leave the room. They're even given a hand when they get up and go to the bathroom. So there's a complete safety physically. They may have experiences of fear, sadness, anger, and in fact most people do have a very emotional experience. We consider that to be part of the healing process.
And my face was like, it felt like comedy and tragedy in my face. And I said to Jeff and Drew, I said, you know, I may look shattered to you, you know, but there was so much feeling, and you're kind of up there in a very celestial environment, but it wasn't, for me, it wasn't visual. It was corporal, but it wasn't just confined to my eyes. And maybe that's why you wear a blindfold, I don't know. But I just started, they didn't want me to talk, so I just started, you know, I just started using my hands. You know, I want to live a long life, you know. You know, I want to live, I don't want cancer to come back, you know. And in some ways, I think I'm better equipped to be with whatever life throws at me or presents, let's say presents. But that doesn't mean that I'm without anxiety. It doesn't mean that faced with something that I don't like, it doesn't mean that I won't despair, but I think that I'm better equipped to face it. And I think I'm also better equipped to appreciate the good things. You know, honestly, that's another thing that the medicine is telling me, is I'm grateful for my life. You know, I'm grateful to be alive in a way that I didn't know I could be grateful. Much more than getting a nice scarf or even a fancy car, you know. It's a kind of gratitude that it's ineffable.
The effects of LSD last for 6 to 8 hours, and the experience is usually followed by a come-down period of 2 to 6 hours. LSD is non-addictive and no withdrawal effects have been reported. Currently, many people are using LSD in what's called microdosing, in very small amounts, oftentimes to enhance perception or productivity. There are a number of studies that have been done on LSD, including double-blind randomized active placebo-controlled pilot study to examine safety and efficacy. And I refer you to this Journal of Nervous and Mental Disease report suggesting that LSD was safe and feasible for use. There are many, many types of hallucinogenic mushrooms. Let's talk for a moment about mushrooms that contain what are called psilocybin and psilocin. There are hundreds of these different types of mushrooms. In the vernacular and the street, they might be called mushrooms, magic mushrooms, shrooms, boomers, and they grow all throughout the world. Most particularly used are those that are grown in Mexico, Central America, where they're used in religious ceremonies. Most psychoactive mushrooms contain psilocybin. Psilocybin mushrooms are less potent and shorter acting than LSD. Most psilocybin and psilocin act on the serotonergic system like LSD and like many of the psychedelic drugs. The effects of the mushrooms begin 30 to 60 minutes after ingestion and last about 4 to 6 hours. Some of the early use of psilocybin mushrooms in psychotherapeutic therapy was used by Timothy Leary, who used psilocybin to treat prisoners, theorizing that altered states engendered by the drug might lead to reduced levels of recidivism. Recidivism was not found to be affected, however, in that study when long-term research was explored. Psilocybin use has been associated with profound spiritual experiences that have lasting effects. Some of the psychological effects include shifts in mood, perception, visual changes, and perceived changes in time and space. When it's given to healthy subjects, it's found to be safe, though it's advised against use with people with cardiovascular conditions or hypertension. Psilocybin has been studied along with LSD to prevent or treat cluster headaches, and there's been reported efficacy and remission. Peyote. Peyote is a cactus that grows in the deserts of central Mexico and as far north as Texas. Peyotl is the original term, the Nahua term that means furry thing, and it refers to the top of the cactus. And a Wixárika man is quoted as saying, "Peyote is the crossing of the souls. It is everything that is. Without peyote, nothing would exist." And I share with you here the Huichol or Wixárika trinity of the deer, maize, and peyote, the sacred trinity of the annual pilgrimage. And following this annual pilgrimage, you see here visionary art that is created. And this art is created by slathering beeswax on a board, or it might go on a skull, an animal skull, or it might go on a carved piece of wood. And then yarn is placed, such as you see here, to tell the story of the vision that the individual had. They may also not only use yarn, but they may use beads. As you see here in back of me on the skull, a gift to me from a Wixárika shaman. And as you see in this beautiful painting, you'll see the peyote buttons in the middle. You see what's called the ikuri coming out of the peyote buttons. That's the energy force. And it's all contained in a big bowl, and then you see the snakes and this beautiful vision. And on the back of the board, the story is written out. Now, the fresh or dried heads of the peyote cactus are called peyote buttons. They're eaten, they're made into a tea, or they're powdered, and there are over 55 alkaloids in the peyote. The main alkaloid is called mescaline. And the use of peyote spread to North American Indians by the Mescalero Apache and the Lipan Apache of Mexico. American Indians use peyote to dispel bad spirits believed to be causing illness, used for diabetes, pain, colds, bites, alcoholism, headaches, blindness, menstrual disorders, and broken bones. And the Native American Church is really organized as what's called a pan-Indian religion. It brings together all kinds of people, both Indian and non-Indian. It evolved directly from older Mexican forms. It is a church that is authorized to conduct legally the peyote ceremony in the United States. And the Native American Church transcends borders. And it's based on the use of the peyote cactus as a sacramental medicine. And the Native American Church developed in the late 19th century in response to the community trauma of colonization that occurred both with the Spanish in Mexico and Europeans in what became the United States. Participation in the Native American Church requires abstinence from alcohol and drugs. It offers an important resource to participants who are detoxifying from alcohol. And again, it is not only the plant sacrament, but it is the group ritual that reinforces and enhances recovery and maintenance of sobriety and achievement of health and well-being. It's a holistic communal ceremony during which the peyote spirit may illuminate an answer or knowledge about a problem. Peyote and the Native American Church offer a model of a traditional entheogenic ritual that's designed for modern times. It's a healing context that provides alternative to drug and alcohol, and it often will provide an indigenous-centric alternative to Alcoholics Anonymous, where that's not an approach that's going to be embraced by particular individuals or people who are cultural adherents with another belief system. It fosters positive cultural practices, it supports individual and group identity, it mitigates the ongoing effects of colonization, also called historical trauma and present complex trauma, and it promotes health in areas beyond addiction. Ayahuasca and DMT, called the spirit molecule by Dr. Rick Strassman. Ayahuasca is a combination of words aya, meaning spirit, and huasca, meaning vine, vine of the souls. And ayahuasca is generally a combination of 2 or more plants. The Santo Daime religious practice in Brazil and globally is one of the major channels for the dissemination of the ayahuasca ceremony. And as with all of these approaches and methods and substances, we have both recreational use, we have abuse, but we also have therapeutic and spiritual practice. So remember that chart that I provided to you. We've got a spectrum of use that's going to be important to us as clinicians. Is it helpful or is it harmful? Is it ritualized or can it be enhanced? The main hallucinogenic alkaloid of ayahuasca is DMT, dimethyltryptamine, and as I say, Dr. Strassman, a psychiatrist who studied DMT quite a bit, calls it the spirit molecule. It's a serotonin analog, and near-death and mystical experiences are hypothesized by Dr. Strassman to be a result of DMT produced by the pineal gland. And DMT is found in all humans, animals, and plants, so it's ubiquitous. Ayahuasca has a legal status in the United States that's always shifting. The plants used to make the brew are generally not regulated, but the main psychoactive component is a Schedule I illegal drug. However, the ayahuasca ceremonies have been approved by the U.S. courts for legal use as well, particularly by religious groups. So if this is an area that you hear your clients talking about or you're interested yourself, you'll want to explore certainly legality and exposure issues. There are a number of both organized ritual ceremonies that are going on not only in the United States but all over the world, and there are certainly also ritual recreational ceremonies that people participate in as well. DMT and toad licking. The psychoactive toad of Mesoamerican traditional medicine secretes large amounts of DMT, and this has given rise to a traditional practice called toad licking. I don't encourage it, but there's been a long history of the medicinal use of toads. in West Mexico. For example, one tradition is rubbing oil on the toad and then rubbing it all over of the body affected by erysipelas. And so when finished, the toad is washed and released back into the wild. So another dip into traditional medicine practices that we can learn from. As I mentioned, research into ayahuasca-led retreats is going on all over the world. It generally integrates counseling and ceremonies. One study was conducted that looked at the use of an ayahuasca retreat with Aboriginal population in Canada and found statistically significant improvements in scales measuring hopefulness, empowerment, mindfulness, and quality of life, meaning and outlook. Self-reported use of alcohol, tobacco, and cocaine use declined. Cannabis and opiate use did not, and it was believed due to those being prescription medications. But there was a significant reduction in problematic cocaine use. All participants reported positive, lasting changes over time. MDMA, also known as ecstasy, is really not so much an entheogen, but more an empathogen, that which encourages empathy. It generates a state of empathy, also called an entactogen, meaning to touch within. And empathogens are really a subcategory of psychedelic drugs. Research shows that it decreases activity in the amygdala and facilitates an exploration of traumatic memories without the fear response. This is the subject of ongoing research right now for the use of MDMA in PTSD treatment. It's been found to increase oxytocin and prolactin, which enhances bonding and attachment. It also increases norepinephrine and cortisol and might enhance the rate of extinction learning. MDMA is safe to administer to humans in controlled clinical settings and causes few adverse events. However, research has found that a particular enzyme, the CYP2D6 enzyme, which metabolizes MDMA in the liver, may be absent or deficient in up to 5 to 10% of Caucasians and African Americans and 1 to 2% of Asians. And people without this enzyme should not use MDMA, according to Dr. Holland. MDMA is being used widely with the use of psychotherapy. One research project looked at its use with 6 women with chronic PTSD following sexual assault. Low doses were safe psychologically and physically, and it's believed to reduce fear and anxiety in discussing and exploring the traumatic events, but also improves openness and trust and the therapeutic relationship. Other studies include chronic refractory PTSD, resulting in a resolution of symptoms, and most of the work is going on with PTSD. Low doses of MDMA help people be gentle with themselves, lower defenses, and be open to the psychotherapeutic process. Dr. Holland suggests a therapeutic dose of about 125, and as you explore the research, you'll see low dose to moderate dose of 125 milligrams. It's chemically similar to mescaline, which along with MDMA belongs to the family of phenylethylamines. It releases a flood of serotonin and dopamine. It increases the affiliation hormones of oxytocin and prolactin, leading to the profound sense of empathy and, again, deepening trust with the therapist. Ketamine, also called Special K on the street or K2. Traditionally, it's used as a dissociative. It's used in veterinary medicine as an anesthetic. It's also used as a psychedelic in very much smaller doses. It's widely used recreationally for psychedelic and dissociative effects. It has a slightly addictive quality, psychologically speaking, but it's also been used to treat addiction in the controlled setting. It's currently listed as a Schedule III illegal substance. It's currently used openly in psychiatry for the treatment of chronic depression and suicidality. Low doses have been explored as an antidepressant and as a transpersonal drug for death anxiety. It's been used for treatment-resistant depression. It's also been studied and used for alcoholism and heroin addiction. And so there's lots of application and a number of psychiatrists working worldwide in the application of ketamine, also for chronic pain. Small doses to treat pain have been reported to producing lasting pain-reducing effects. Now, there are some adverse effects that have been identified, can be confusion, visual and perceptual changes, increased blood pressure, dizziness, increased libido, all of which have been observed to subside. And in my own practice, I'll often refer people to a compounding pharmacist with a prescription for a neuropathic pain cream that's made up of ketamine, ketoprofen, and capsaicin. So there's lots of application for ketamine. You want to work with a prescriber and someone skilled in its application. Let's look at iboga and its substance derivative, ibogaine. Iboga is a plant that has been used for centuries in religious ceremonies and traditional medicine by the Gabon and Congo cultures, called Tabernanthe iboga. The Fang Biwiti cult is a syncretic neo-Christian religion. The powdered iboga roots serve as the Eucharist in the Mass. It's non-addictive. Ibogaine is the extract drug from the plant. Atypical opiate that appears to alter the addiction circuit by acting on both opiate and serotonergic receptors. And ibogaine is being explored worldwide, particularly in the United States, in the Caribbean, and in Mexico. And it's used particularly for opiate addictions, and people have experienced after 1 or 2 treatments the lifting of physical symptoms of dependence within 30 to 45 minutes. Several treatments are often required, where people, in one study showed that with a group of 30 individuals who were addicted to oxycodone and heroin previously, unsuccessful at eliminating those drugs, had a maximal treatment effect and a successful effect. And I've given you the references on the research here. Dr. Deborah Mash is perhaps the lead researcher in the United States, the University of Florida, and has a clinic in the Caribbean, and there are clinics in Mexico as well. I think there are underground clinics also in the United States. She quotes, "The visual experience that ibogaine provides helps some people, but not everyone, to receive insights into their destructive behaviors and help them to rewrite their mythology. Aftercare of an ibogaine experience includes an integrative approach to address causes and must create an ongoing self-care protocol." Now, as you continue to explore the benefits or deficits of psychedelic medicine, it's increasing every day in its use. We're seeing more research, and if this is relevant to you in your practice, I encourage you to look at MAPS. This is the Multidisciplinary Association for Psychedelic Studies. They've been leaders in exploring and funding research and collaborating with academics and clinicians worldwide. You can find good research on their site. You can find opportunities for participation in studies, and overall find them as a major resource in the world. Other resources in psychedelic medicine is the Psychedelic Harm Reduction Project. This provides training on how best to support people who have difficult psychedelic experiences. This is generally associated with recreational use or unsupervised use. There's also a new certificate training in psychedelic assisted therapies and research, at the CIIS in California. There is Entheogens in Psychedelic Medicine, the Psychedelic Psychotherapy Forum, and then the MAPS has a psychedelic medicine bibliography. In summary, psychedelic medicine and entheogens. We looked at some definitions of entheogen, the god or goddess within, psychedelic medicine, linked to cultural, ritual, and religious practices, its current use in psychotherapy and other rituals for the treatment of PTSD, depression, anxiety, pain, hopelessness, the applications for a variety of mental health disorders, recreational or self-medication or therapeutic use. Understanding the spectrum of use will inform our clinical treatment protocols. Various states of legality in the US and in other countries. We looked at a variety of some of the major plants and extracts and synthetic substances, but by no means did we cover them all. We understand how they in general target various receptors in the brain, whether they're the opiate receptors or very commonly the hallucinogens target the serotonergic receptors. And then I provided you some ways of identifying the applications and finding resources for research, publications, and collaboration. Thank you so much.